Statistically speaking, I shouldn't be standing here. I'm a community health educator with a score of 9 out of 10 ACEs, or otherwise known as adverse childhood experiences, meaning that from elementary school age, I was exposed to trauma in my environment, which included chaos, violence, abuse, harmful addictions, and the many barriers that can come along with poverty. Low income living felt like this suffocating trap that felt impossible to escape from. And it had me in situations a young person should never have to witness or experience. But thankfully, stories allowed me to mentally step outside of my conditions for a moment. I was obsessed with creating stories and creating new worlds. All of this was just so cathartic to be able to write stories. With it, I was able to mentally step outside of my conditions for a moment. At 25 years old, I found myself in theater. It was my new refuge. It was a space where I could channel my emotions into characters, stories, and performances. This was a place where I found structure and the confidence, and it gave me a way to think about escaping the reality that I was in, but in a healthy way. And I was able to think about my future in a different way. While I was exploring all of this, I was still stuck in the same poverty cycle I had been born into. And I was working multiple low-wage jobs, just barely surviving. Well, in that experience, I found myself just contemplating, well, what am I going to do, right? I'm working these multiple low-wage jobs. I'm in the human services field. It took me 9 years to earn my associate's degree. And I eventually earned my master's degree in community health and prevention science. For over 15 years, I worked within the human services systems that I once relied on. And I was striving to make them more thoughtful and more connected to the people they serve. Thank goodness for the arts and social programs. They're the reason why I'm standing here today, defying the statistics that once represented me for so long. But even though social programs are great, the problem is they continue to rely on conventional methods like slide decks, flyers, poster boards, and infographics, which I get it, I know they all have their place. But I think that we can be a little bit more creative. I think that there are other ways that we can address this. There's other ways that we can reach communities and reach people who work within these systems. One study reviewed 23 different research projects, and it found that not only did theater help people grow in powerful ways, it built empathy and it strengthened communication and it helped people to connect. This is exactly why we need to infuse the arts like theater and film in the field of health and human services. We need real human connection, not just facts on a flyer. Arts and lived experiences storytelling shouldn't be optional. They should be standard tools for training, engagement, and transformation in the field of health and human services. Now, typically after trainings and meetings where dry interpersonal data is reviewed, no one is really moved to action. Let's just be real, right? People leave, they go back to their daily routines and there's no, we've got to do something about this. There's no urgency, there's certainly no outrage, and it doesn't break stigma. Basically, there's no impact. Here's the thing. The data, that's me at 25, by the way, in theater. Here's the thing. The data in human services isn't just a set of numbers. These statistics represent real, living, breathing people. People who come from my community. People who represent my family. People who represent me. In addition to this, in addition to looking at important facts on the slide, we need to invite human services professionals to come and experience the realities of poverty, addiction, and trauma through film, through theater. It should be standard practice for communities to come together and watch relatable stories that can help them heal and transform. They need to see stories that represent their struggles, their resilience, their humanity, and their community. While statistics might tell you what number we are on a chart, they can never tell you our whole story. Now, I know that there are research efforts out there that study the impact of the arts in health and well-being. And I know that in the nonprofit sector, we're always looking for ways to put out initiatives or work on initiatives that help to support this very idea. But what I'm trying to stress today is that we really, really, really need to think creatively. We need creativity if we're going to reach people everywhere. We need to work smarter, not harder, when it comes to our professional development and our outreach initiatives. I believe the funding we use for a 2D format could be better spent spent on the arts, utilizing the arts to tackle the 3D issues. Understand that storytelling is so much more than this artistic thing. It does something that statistics alone can never achieve. When we use the arts and lived experience storytelling in the field of health and human services, we create deeper impact and we help families heal. And I know this works because I've seen it firsthand. In 2019, my social media feed grew dark. Rest in peace post after rest in peace post. So many young people lost their lives in New Haven, Connecticut, where I lived. While facilitating opioid education groups with New Haven public housing residents, we discussed these issues. And I heard raw, painful truths about addiction and loss. These stories felt familiar. They reminded us about the past drug crisis. So I did something a little unconventional. I channeled what I heard and I wrote a play about a family facing poverty and the current drug crisis. With the support of the mental health organization that I worked for, we produced the play at a local theater and we brought together community members. And we included case managers, social workers, and providers, all for performing arts, to sit side by side and watch this play. Afterwards, no one left. They stayed, they talked, and they processed. This moment sparked this new collaboration that would eventually become Silence on the Streets. Let me show you a couple of pictures. This is the play. This was the audience. Silence on the Streets was a project that ended up being funded with discretionary funding from the Office of National Drug Control Policy in New England, HIDA, all off of the idea of this play, because we focused on the core issues. We focused on social determinants of health. We focused on how communities from the past were still grieving, and this was unfinished business. We focused on what efforts need to happen now and what's happening in recovery and the innovation that's happening in the recovery field. But there's so much work to do. I'm sure we could all agree. Well, in 2023, there were so many communities across the country that ended up hosting screenings of this film. And in Connecticut, over 800 people showed up to a screening that was hosted by grieving parents who formed their own community organization to support recovery. In Delaware, right here in Delaware, it moved faith-based communities to openly discuss addiction. We visited incarcerated groups, and I witnessed men and women cry as they started to unpack and think about real change and what they can do when they were out. This is why this is so important. We've got to use the arts. We've got to use the arts, and we've got to use lived experience storytelling in order to move mountains in this field. If we don't do something creative, then we're stuck. And this is a field that needs a lot of innovation. This wasn't just about a film or a play. This was about opening a door to community healing that traditional methods never could. This fusion is what we need to create true impact. We need to humanize the data. Lived experience and the arts is what we need to motivate communities, motivate individuals, whole societies to open up, heal, and change.